We'll give everyone a couple more minutes, and then we'll go ahead and get started. So we can go ahead and get started as the remainder of our participants trickle in. But we'd like everyone to please give a warm welcome to Michelle, our nurse practitioner guest speaker today. She's super excited to be speaking to all of you. So I'll turn it over to her and let her get started. A reminder that if you have any questions for her, please save them for the end and you can raise your hand or ask them in the chat.
All right. Hi, everyone. Thank you so much for having me here. I did make a presentation for us, so I'm going to try to see if I can share my screen. Okay. Okay. Can you guys see my screen? Yay. Okay, perfect. All right, you guys, let's go ahead and get started. Again, thank you so much for having me here today. I'm really excited to be able to talk to you about the profession of being a nurse practitioner. And for those who are interested in this career pathway, I hopefully can share some tips and advice on how to become a nurse practitioner. But before we start, I just also want to mention that anything I talk about today are strictly views of my own and not necessary of my employer or any educational institute. So before we begin, just out of curiosity, how many of you guys here actually know what a nurse practitioner is? And if your definition is, oh, they're just like doctors, then I want you to delete that definition from your brain. And hopefully by the end of this talk, you'll have a much better definition of what a nurse practitioners are. But let me just give you a quick history lesson here. Nurse practitioner, the very first program was actually founded in 1965 by a nurse named Loretta Ford and a physician named Henry Silver. And they created the nurse practitioner program to really increase healthcare access for people who wanted to get healthcare and also to make it more affordable as well. And ever since then, the nurse practitioner profession has just grown so much. And in fact, U.S. News and World Report ranks nurse practitioner as #1 on its best healthcare jobs of 2023. And also nurse practitioner ranks #2 as its 100 best job of 2023 and the best STEM job. So it's a really, really cool profession. So a better definition of what a nurse practitioners are, they are registered nurses who have gone back to school for advanced training to be able to assess patients. We can order and interpret labs, manage disease, prescribe medication, and figure out treatment plans. And in addition to managing all of these chronic conditions, we also focus a lot too on wellness and health prevention. So this right here is the agenda that we have for today. I'll tell you guys a little bit more about myself, my pathway to becoming a nurse practitioner. I'll also share with you a little bit about what it's like to be an urgent care nurse practitioner, and then hopefully give tips on how to get into this profession. And for those who aren't interested in this pathway, I also would like to share some just general advice I would give my younger self, and then we'll hopefully have some time for a Q&A afterwards. But yeah, let's talk a little bit more about myself. I have been a family nurse practitioner now for 9 years, and I've had experience in primary care, urgent care, and telehealth. Prior to becoming a nurse practitioner, I worked in aesthetics, plastic surgery. I've also done ortho surgery, general surgery, ENT, and I did a small stint in a GI lab as a registered nurse. And I also started off my nursing career as a nursing assistant. So why nursing? I've always wanted to go into healthcare when I was younger. I immigrated with my family here when I was 4 to the US, and we didn't really know anyone, so we kind of all just stuck together. And being the only girl in the family, I had a lot of experience taking care of my brothers anytime that they would get into trouble. My dad also was in the hospital quite a few times when I was younger, and that was my first exposure to nurses. And I was in absolute awe when I saw them. I I thought it was so amazing how not only did they take care of my dad, but they also took care of us. They asked my mom how she was doing. They made sure that we understood what was going on with my dad and kind of like what the treatment plan was. And I never saw anyone else do as much as they do. And so that experience right there kind of just solidified my reason for going into nursing. So with that in mind, my plan was to be a nurse. I did running start when I was in high school, and I actually managed to complete all of my prereqs. And then I started applying to nursing school. While I was applying for nursing school, I figure it's probably a good idea to have a backup plan just in case I didn't get into nursing school. So I started a nursing assistant program. Unfortunately, I did not get in my first round of application. So I did work as a nursing assistant in a skilled nursing facility for a while. And then on my second round of application, I did expand it to associate programs. And kind of just a side note about nursing school. Here in the US, there's two options that you can do. You can go to a university and get your bachelor's. You can also go to a community college and get your associate. Both programs will prepare you to sit for your NCLEX, which is your nursing boards that you take. There are some differences between the two. And honestly, the difference is like a whole talk in it itself. So if anyone is interested, I'm more than happy to have that conversation offline to kind of like go over it a little bit more. But like I said, I expanded my applications to associate nursing programs the second time, and I did get accepted into the associate program. I found out that in my first quarter of nursing school, that after I finished the first quarter, I could become a nurse tech. And nurse tech essentially are nursing assistant. You mostly work in hospitals, but because you're a nurse tech and they know that you're a nursing student, they're very, very flexible with your schedule. And also physicians and other nurses, because they know that you're in nursing school, they always pull you to see really cool procedures or like show you really interesting case. So for anyone who's interested in nursing school, definitely kind of like keep that in the back of your mind to see when you're eligible to apply to be a nurse tech. I graduated from nursing school, and actually, let me go back really quick. When I was a nurse tech, I worked in med-surg and I worked in the OR, and my experience in the OR really made me fall in love with surgery. So after I graduated from my nursing program, I became a perioperative nurse, and that was where I spent most of my time as a registered nurse in the operating room. My initial plan was to be a nurse, get some experience, go back, get my bachelor degree, and then become a nurse practitioner. But while I was looking for these bachelor's program, I stumbled upon a program that was offered at one of the universities in my state where they prepared associate nurses to get your master's and then eventually go into their family nurse practitioner program. It was one of the first program of its kind that I saw. And because I knew it was coming from one of the universities in my state, I knew that was a legit program. So I applied and I actually got accepted. The program itself is much longer than your traditional route, and we'll talk a little bit more about that later on. But I got accepted, and I spent that whole program itself took probably about 3.5 years or so. But I graduated, took my boards, and became a nurse practitioner. So let's just kind of fast forward here. I currently work in urgent care. My organization is trying to increase our healthcare access. So we are seeing a lot of primary care, but my love, I think, truly resides in urgent care. And here are some of the reasons. One of the things that I love about urgent care, and one of the things that I myself am really interested in, is that I love instant gratification. I love it when I have a patient who comes in to see me, they're not feeling very well, and it's within my power to do something to make them feel better, either give them medicine, or let's say they come in for a cut. I am able to just like sew them up and send them off, and they're all fixed and they're all healed within a couple of days to a week or so. I also love getting to do procedures, and in urgent care, you get to do a lot of procedures. You get to sew people up, you get to drain abscess, you get to, dig weird things out of different body parts. It's just really, really fun. I also love how in urgent care, you never know what comes in your door that day. Like you can see someone coming in for like cold and flu, and then you can see someone else coming in with this nasty cut. And so it's really unpredictable, but unlike the ER, it's not that unpredictable. I am not interested in seeing like gunshot wounds or anything bizarre like that. And so I find the acuity in urgent care is just perfect for me. And then in addition, at my current urgent care that I work right now, like I just love my work-life balance. I love that when I'm off of work, I'm completely off of work. I don't have to take call. I don't have to finish my charting at home. Like when I step out of those doors, I truly am off, and that gives me a really good work-life balance. I have 3 younger kids, and here's a picture of them. And I just find that I get to be more present in their life. So yeah. But anyways, let's talk about the route to becoming a nurse practitioner. The traditional route, and I will say one of the things about nursing is that you can enter nursing in so many different ways. There's the traditional route that most people can go through, but I've also met so many people where nursing is like their second career, or, they've done something else with their lives, and, now they're coming to nursing through a different pathway. But typically, the traditional pathway of becoming a nurse practitioner is that you finish your nursing prereqs, you go to nursing school, you graduate from your program, you take your NCLEX, you get some experience, and then you apply to your graduate program, graduate from it, take your boards, and then you start working as a nurse practitioner. There are a couple of caveats I want to mention. Is number one, gaining nursing experience. There are programs right now where you can apply to go into a family nurse practitioner right out of nursing school. It may work for some people, but I think that if you have time and if you are able to, it's so important to get experience before you apply for grad school. Grad school will teach you how to figure out what's going on with the patient, disease management, and treatment plans, but they don't necessarily teach you critical thinking. When you work as a nurse, you get these experience that you can never get anywhere else, and school will never be able to teach these experience to you. You get to learn how to think on your feet. You get to be in situations where, again, you wouldn't learn it in school. You'll also learn how to form relationships with your patients. I mean, I can give you a lecture on how to build better rapport with patients, but unless you actually do it by yourself on your own and you do it multiple times, it's very, very hard to do. And so gaining that nursing experience, I think, is so essential in your success as becoming a nurse practitioner. Now, let's talk a little bit more about the non-traditional routes. There are some accelerated programs that you can do. Most of the time, though, these accelerated programs will require that you have a bachelor's in something else. So it can be like communication, it could be like biology, chemistry, but as long as you have your bachelor's, typically the first year of these accelerated programs will be getting you ready to take your NCLEX, getting you ready to take your nursing boards. And then after that, the next 2 to 3 years, depending on how long that program is, will prepare you to be a nurse practitioner. Now, some of these programs here will either be like in-person programs where, you go to class in person. They also have hybrid programs that are available where most of your didactics will be online. And then maybe once or twice every quarter or semester, you'll actually go on campus and get hands-on experience. You'll do testing and things like that while you're on campus. And then the other options are online programs, and some of these programs are 100% online. And for those who are looking at these programs, I caution you, because one of the pitfalls, I think, of being a nurse practitioner and of our education is that our curriculum is not standardized. The Board of Nursing provides certain criteria that school would have to follow. And as long as you follow these criteria, you are accredited and you can take on students. But that doesn't necessarily mean that it's a really good quality program. And nurse practitioner programs, I find for the most part, or I think honestly with any like any programs in healthcare, you have to take charge of your education. No one will tell you like, this is what you have to do. Like they'll tell you that, but you also have to invest in yourself and do a lot more on your own. These online programs here sometimes will have you finding your own clinicals, which can be very difficult to do. And again, sometimes the instructor and their curriculum and how they teach you are not always the best. So like I say, be very cautious when you're looking at these 100% online programs. I think hybrid programs are fine because you're still going in person and you're getting that one-on-one, but sometimes you don't get that with online training programs. So again, just be a little bit careful when you're looking at it. Now, the other thing too is when you are a nurse practitioner, there are many, many different types of nurse practitioners, and these are some of the ones that I listed out. Nurse practitioners, the way that we operate is that we are taught on very specific population or on very specific patient population. Family nurse practitioners, they are a little bit different in that we are taught to be more like generalists. So we learn a little bit of everything. And we act a lot like primary care providers, or you'll see a lot of us work in like the primary care area, and we can see patients of any age at all whatsoever. So when I was in primary care, I would do like a 1-day well child check, and then my next patient would be like a 102-year-old woman with a UTI. So we see everyone and everything essentially as a nurse practitioner, but there are different types of programs if you are interested in just one certain population. So we have like your gerontology for older adults. We have an emergency room nurse practitioner program. You can do psych if that's really what you're interested in. We have women's health, neonatal, pediatrics, and we even have midwifery. And so you can actually be a nurse midwife and deliver babies if that's something that you're really interested in. So let's talk about tips on getting into nurse practitioner programs for those who are interested. I hate to say this, but grades matter. If you are interested in continuing your education, regardless of where you're at, grades absolutely matter. In high school, a 70% is a C, and a C is technically passing, but in nursing school, a 70% is failing. I believe in my nursing program, 85% is what is needed to pass. So again, grades really, really matter. Number 2, in order to apply to a nurse practitioner program and stand out as an applicant, you want to get as much experience and exposure to the profession as you possibly can. And some exposures that you can get are shadowing opportunities. And I encourage everyone to shadow, whether like if you're able to shadow like more than just a day, that's awesome. But any type of shadowing is so valuable, not only because you'll kind of see what these people are doing, but you'll also see, is this something that you actually enjoy doing? And just making sure that, you shadow more than just one person, and also try to shadow in different settings. Nurse practitioners, we can be found everywhere. We can work in hospitals, we can work in schools, we can work in clinic. And so shadowing people in different areas on different days just shows on the application that you are really interested in this and you kind of know what you're getting yourself into. And then tying on, if you are able to get hands-on experience, so whether you're working as like a nursing assistant, you are working as like a medical assistant, or anything like that before applying to nursing school, like that's going to make you look so good as an applicant, because again, it shows that you know what you're getting yourself into and you're committed in this profession once they do accept you into this profession. And then the third thing that I would recommend is your personal statement. So your personal statement basically tells admissions why you want to get into this program. And if you say things like, I want to be a nurse, or I want to be a nurse practitioner because I want to help people, that's not a very good statement, because any profession can help people. You can be like a grocery store clerk and you're still helping people. You really want to answer, what about being a nurse practitioner will make it different? Like, how can you help people in that profession? And that's really going to help you stand out as well. All right. Let me share with you some general advice that I would give my younger self if I could. Number one, going back to, just shadowing opportunities again, shadow, 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 like as much as you can, just shadow, just as much as you can. And even if you are like, I know I don't want to work with kids, or I don't want to work with older adults, I also recommend shadowing in that area as well, just to really make sure that this is not what you want to do. I remember when I was in nursing school, I told myself that I really wasn't interested in working with kids. I really don't want to work with like pregnant women or do anything with like labor. And so I kind of just closed those doors. And now as a nurse practitioner, I actually really enjoy working with kids. I love working with pregnant women. And so I kind of regret closing those doors and not getting those types of experience as a registered nurse. So I always tell people that, shadow areas that you really love and shadow areas that you don't think you like, just to make sure that you don't actually like it. The other advice that I would give my younger self is that the medical community is very small. Even if you live in a huge city, the medical community itself is very small, and there's a pretty good chance you're going to see someone from your past if you're in the medical field long enough. Just to kind of give a quick example, when I was in nursing school and I was doing my senior practicum, the ER manager who was helping me set up my schedule, years later as a nurse practitioner, she actually applied to my current organization, and I was the one that was actually training her. And we didn't make that connection until like a week later of us being together. So again, it's a small community. Make sure you're kind and you're nice and you're always putting your best foot forward with anyone that you meet. Because again, you'll never know when you'll see them again. And then I think the last piece of advice is don't give up. I found that nursing school for me was very hard. As a high school student, I was a straight A student, and I thought that nursing school wasn't going to be very hard. And boy, was I wrong. In high school, I was used to just going to class every day. I was able to finish all the homework assignment that I was given. But in nursing school, the setup is just very different. You have one day where you are in class, and then the second day you are just doing skills lab. And at the end of the week, you can have like 50 different chapters that you're reading. And I remember it was such a struggle keeping up with all like the reading assignments and everything. But I was really fortunate. I had great classmates. We kind of developed a support group, and we just supported each other along the way. But yeah, it's going to be a very difficult road. I'm not going to lie. It's very hard. In my last quarter of grad school, I was so stressed out. I broke out into like a whole body rash. And that lasted for like 3 months until the stress was gone. So it's really stressful. Don't give up. And any negative feelings that you're feeling, just know that someone else is probably feeling the exact same way that you are. We don't really talk about it. And I think that's a real shame. But once someone says one thing, you're going to find that other people in your class, other people around you who are in very similar situations. And hopefully you can kind of just use them as your support group and just cheer each other on. And that kind of just concludes my presentation that I have. I know I kind of went over things pretty fast, but if you guys have any questions at all, I'm more than willing to take it at this point.
Awesome. Okay. So first, before we get into any questions, we have a little tradition where we give our guest speakers a little virtual round of applause. So if you'd be able to hit your reactions button and give Michelle a round of applause just to say thank you for her wonderful presentation and all of her advice about being a nurse practitioner and her journey into this field, that would be much appreciated. And Michelle, there are lots of people saying thank you in the chat.
Oh, thanks, you guys.
Okay, so if you have questions, please ask them in the chat or raise your hand. We have a couple of people with raised hands right now, Michelle, so feel free to call on them, or if you want us to call on them, please let us know.
All right. I'm going to let you guys call on them because I'm not very good with this. And so I'll turn that over to you.
Okay, so I can kind of counterbalance and do one person that has their hand raised and then go to the chat, and we can alternate. All right, so Omar has their hand up first.
Okay, actually, I have three questions. The first question, can you recommend us the best online nurse practicing program?
So just to kind of recap, did you just ask, can I recommend like a good nurse practitioner program?
Right,
Gotcha.
online program.
Oh, online program. I don't have a good online program that I would recommend. And I say
Oh,
that because I am a little bit biased against some of these online programs. I don't think that they, number one, prepare students very well. And number two, you're paying a lot of money for these programs, but you're doing so much more than you really need to. Again, you're finding your own clinical placement, which itself very, very difficult to do, especially if you don't have any healthcare connections at all whatsoever.
okay. My second question, what is the difference between nursing, normal nursing and nursing practitioning?
Yeah. So what's the difference between a nurse and a nurse practitioner? So
Yeah,
nurse practitioners in the United States, more than half of the states in the United States, nurse practitioners are completely autonomous in that if we wanted to, we can actually go out and open up our own medical clinics. We don't need a supervising physician. A registered nurse is someone who will always need to have supervision, whether it be a nurse practitioner, whether it be a physician, or either like a physician assistant, but that's kind of like a gray area in itself. A registered nurse, you'll usually find that they're the one that's carrying out the orders. They're the one that's going to be with the patient longer, especially if this is the hospital setting. They'll be the one that's, taking care of these patients their whole entire shift. Whereas like with nurse practitioners, we do more of like the managing. So we'll go in, we'll check the patients, see how they're doing. We can update any orders that are needed, but the registered nurses would be the one that's actually taking care of the patients and and doing these orders essentially.
okay, like that we can say that a nurse practitioner is higher than a nurse, a normal nurse, right?
Yeah. So in terms of scope of practice, nurse practitioners have a much wider scope of practice than a registered nurse.
Okay, my last question. Sorry for being long. What is the hardest thing that you got in front of you in your nursing studying period?
I'm sorry, repeat that question for me one more time.
What is the most hardest thing that you got in front of you in your nursing studying career or period?
Gotcha. Are you just to kind of rephrase, are you asking me like what was like the hardest like subject, or what was like my biggest challenge when I was in
Your
school?
biggest challenge?
My biggest challenge in school. I think my biggest challenge in school was time management and figure out a studying plan that would work for me. In school, again, you learn so many things. When nurse practitioner programs, for the most part, they are about 2 years. And they cram so much stuff in that 2 years. In medical students, they have like 4 years of schooling. They do, 3 to 4 years of residency afterwards. So they have a good solid chunk of time to learn so much. But as nurse practitioners, we kind of just cram everything in those 2 years. And so I think my biggest challenge for me was really figuring out what my learning style was and then actually sticking to it.
Okay, thank you so much.
You're welcome. Thanks. Those are great questions, by the way.
Awesome. Okay, so a question from the chat. Someone asks, do you have any tips on cold calling or emailing as a high schooler? How do you handle patients that might sometimes be rude to you?
Yeah. So do I have tips on cold calling and emailing as a high schooler? And I want to say, if you start off in high school and you do these, you are kind of like at an advantage. Anyone who works in healthcare, like we want to expose our profession to anyone who will listen to it. So if you email or cold call and you just let them know, hi, I'm a high schooler who's really interested in this particular profession. I would love it if I could shadow you, for, even like one shift to see how things would be. Sometimes, if you do have some relevant like healthcare experience, that would be really nice to put in the email just so so whoever you're emailing can kind of get a sense of you. But and I would say just honestly, like email or cold call like anyone that you possibly can. Let them know that you're a high school student. Again, that's like a really good, that's a really good thing. Being a high school student is actually a very big plus, and it'll show people too that like you're very serious about this, and and they'll give you more of an opportunity to shadow. And then I think the second question was like, how do I handle rude patients? I have a lot of experience working in urgent care there. And I find that a lot of times people who are rude, they don't understand why I say no, or they don't understand why things are the way that they are. So I find that if I just take a step back and I explain to people, I explain to people like why I can't give you antibiotics for your cold, or explain to people I can't order an MRI for, this injury that you just had 2 hours ago. It puts things in perspective for people. And then I also find too that if people are rude to you and if you're just kind back to them, it kind of just changes that dynamic a little bit, and they actually like bring their anger goes down, and then they start to get a little bit kind to you as well, because you're just like you're just showing them kindness and you're just explaining things to people.
Perfect. Thank you. So I think our next hand raised is Kaylin.
Thank you. Hi. Thank you
Hi.
for the presentation. It was very nice, very informative. I have two questions for you, and I think somebody else in the chat also mentioned this question. But for you, what do you think, where did you find the most helpful shadowing experiences? Was it at your local hospital? Did you find it just by like messaging your doctors or whatever? That's something that I'm really interested in, and I've had a hard time finding those opportunities. So I'd like to know, have your advice on that.
Yeah. So what I would recommend in terms of like, if you want to shadow and just kind of get your foot through the door, I think nurse practitioners in clinics may be a better, I don't want to say a better option, but it might be easier to shadow, because typically clinic work, it's not as fast paced and it's not as ever changing as hospitals. And so I would say try to reach out to nurse practitioners in your local clinics. And I'm talking about, and I also would probably recommend starting at clinics that are from a bigger health organization. So let's say in your area, if you have like this healthcare system, like, and it's one of the bigger ones out there, I would recommend, looking at their clinics that are closest to you, and then just sending an email either to them. But the other thing that I would also recommend too is if you go to their website, there's usually an area at the bottom about like education, or like continue education. If you go down there, you usually will find an email to someone in the education department. And if you email them and you let them know, hi, I'm a student, I'm really interested in becoming a nurse practitioner, do you have any programs that are like that? Or, would any of your nurse practitioners be able to let me shadow them for a few days or just one shift? And if you are able to actually get through to them, it's nice because they have access to all the nurse practitioners in that healthcare system. So right there, instead of, cold calling just one person, you're emailing one person who has access to all these different types of people. So I would definitely recommend doing that.
Thank you. That was really helpful. I didn't know that there were, specific sections of websites dedicated to that. My second and last question, you mentioned personal statements when you're applying to med school or to nursing school and stuff like that. That's something that I've had a lot of struggles with, especially when it comes down to like writing my college essay even. So in your opinion, would you say that maybe citing a personal story, some sort of connection you have with the medical field would be helpful in writing your personal statement? Like for you, did you bring up your father's history with hospitals and stuff like that in your personal statement?
I definitely did. Because, the long run admissions, when they're looking at these applications here, they want to know that if they accept you into their program, you're going to want to stay in this profession. You're not doing it just to like do it and then, I don't know, get fed up and then go do something else. Like these people want to know that you are really serious about this career pathway, and including any like personal stories that shows kind of like your tie and like your desire. And that's not saying like you have to have a personal story, but if you do have a personal story, I definitely recommend doing that. But if you don't, again, and if you don't have a personal story, again, really think about it. Like, how can I help someone as a nurse practitioner? Don't ever start off as a personal statement with, I want to become a nurse practitioner so I can help people. Like it's so vague. It does absolutely nothing. And sometimes like that can actually be something against you because you're not being specific, and you want to get down to like the nitty gritty and like be as specific as you possibly can.
Thanks so much.
You're welcome.
Awesome. Okay, so our next question is from the chat. Someone asks, how do you narrow down what you want to do in the medical field, and how did you do that?
Oh, that's hard. So I always joke around with my friends before I got accepted into nursing school, that I was afraid of commitment. And that was one of the reasons why I chose not to go to med school, because back then I thought if I did medical school, I would have to pick one route, one specialty, and be in it forever. And if I ended up not liking it, I would have just wasted like 8 years of school. And that was just really painful for me to digest. And so what drew me to nursing is that nursing is so flexible. And now knowing what I know, I think you don't know what you want to do or what you not want to or don't want to do until you actually have experience with it. So for people who are kind of like, I don't really know what I want to do, nursing is a great pathway because you get to be exposed to kind of everything. And let's say you become a nurse and you work in like cardiology and you're like, I hate cardiology. You can do ortho, you can do dermatology, like the possibility is just endless. You have this doorway of like doing anything that you want to do. And that's the other thing too, is like, if you aren't sure what you want to do, shadow someone in that area if you possibly can. That way it'll give you some exposure and you can include that on like your resume when you're applying. And again, it's going to make you such a stronger applicant because it's showing people that you are so dedicated to this profession. You know that this is what you want to do. So if you're not quite sure, I would say shadow. I honestly wasn't quite sure what I wanted to do, even though I shadowed. And so I just picked areas that were very general. That's why when I became a nurse practitioner, out of all the specialty that I could choose from, I chose to be a family nurse practitioner because it was just a little bit of everything. And I can decide later on, like, is there one area that I want to focus more in, or if I just still want to just be like a generalist.
Perfect. Okay, our next hand raised is Daria.
Hello, I have two questions. I was wondering, like, what my first question is, like, what's your most rewarding part of your career?
Yeah, what is the most rewarding part of my career? Okay, you guys, it's going to be so cliche, but the most rewarding part of my career is when I can use I can use my scope of practice and get someone something that they're not able to get. So let me share with you this amazing story. So I think it was earlier this year, I had a patient who came to see me in urgent care. And, urgent care is more for like when you have colds, flu, you break something. We typically don't do like long-term, like chronic care. But she came and she saw me for stomach pain that has been going on for like 6 months now. She has seen her primary care provider. She saw a specialist. And and they couldn't figure out what was going on with her, and she needed to get an MRI. That was her next step. But unfortunately, her insurance company kept on denying the MRI, and she was just at a loss. She was in pain. She didn't know what to do. She was crying when she saw me. And I was fortunate enough to work in an area where we had access to a CT machine, and I could put that order for a CT machine where it would bypass her insurance and she can get the CT scan. And that's what we did. And unfortunately, the CT came back showing that there was bad news that was ahead. But I was able to help her get those answers. And that's honestly one of the most rewarding experiences that I can experience in healthcare.
That's nice. And my second question is like just like a background for my question. I'm interested in being like a dermatologist or a plastic surgeon, and I was wondering like what is the difference between like a cosmetic nurse and those other two physicians, like in a work setting?
Yeah. So just to clarify, I think you're asking about what the difference between dermatology and plastic surgery is. Is that correct?
Well, no, like sometimes like the roles between a nurse and a doctor, like when they work together. Like
Oh,
that
okay. And when you say nurse, do you mean like a registered nurse or do you mean a nurse practitioner?
Just a regular nurse.
Like a registered nurse. So the difference between the role of a registered nurse and let's say a dermatologist, like a doctor, like a dermatologist or a plastic surgeon, again, plastic surgeons and dermatologists, because they are doctors, they are able to set the orders, come up with the treatment plan for certain things. Whereas like with registered nurses, they're the one that's carrying it out. So for example, let's say we have a patient come into a dermatologist's office, right? And they have, let's say they have this suspicious they have this mole on their arms. A dermatologist will be able to go in there. They will get the history of like, when did this mole first appear, any characteristics about it. And then if the dermatologist decides we should biopsy it to see what's going on, then the dermatologist would be the one who's actually doing the biopsy and cutting it out and sending it to pathology. And then after that, a nurse would come in and she would be the one that would dress the wound up. Maybe the nurse would be the one that would do the follow-up visit to make sure that things are healing as they should. And let's say, an infection comes up. The nurse would have to go get the dermatologist because he would have to do the assessment and he would be the person that's saying, yeah, this is infected. We need to put you on an antibiotic. So nurses won't be able to make that diagnose that, oh, there's an infection that's going on. Nurses also won't be able to prescribe antibiotics. Only the dermatologist in this case would.
Thank you.
You're welcome.
Awesome. Okay. So our next question from the chat is, how does a physician assistant, nurse practitioner, and physician differ, and how does their scope of practice differ?
Yeah. So I'll start off with like a physician. They can pretty much do anything. So they can do surgeries, they can do anything a nurse practitioner or a physician can do. And then you have your nurse practitioner and your physician assistant, and you'll actually see a lot of times these two roles are interchangeable, which means they do pretty much kind of like the exact same thing. Physician assistant, for the most part, are not able to function independently, so they will always need to have a supervising physician that is attached to their practice. They also will not be able to go out and open up their own medical practice if that's what they want to do. Again, they'll always need physician oversight. Nurse practitioners are a little bit different because as I mentioned, in a lot of states, we are completely autonomous. So we have that capability to go out and open up our own practice if that's what we really want to. But there are some states where they still require physician oversight. I think, to really see the difference between a nurse practitioner and a physician assistant, you want to look at kind of like their physician's assistant, because they fall under physician, their program will always be at a school of medicine somewhere. Their program will always be standardized, which I think is actually a really big plus, because that means whatever program they choose, whatever program they choose, all PAs will get pretty much the same type of training. So they're not going to differ much. Whereas like with nurse practitioners, because our education is not standardized, different nurse practitioners from different programs can have different experience and different levels. So there's a lot more range difference as opposed to a PA. The other difference too is that with PAs, the way that they're trained, you'll probably see them in other areas more than you would see a nurse practitioner. So for example, like in surgeries, you'll definitely see a lot more PAs than you do with nurse practitioners. However, nurse practitioners, let's say, if you are really interested in surgery, there's also a different certification that you can go and get. It's called an RN First Assist or an RNFA, and that'll allow you to do things that a PA would do in the surgery if you were interested in that pathway.
Awesome, thank you. Our next question is from someone that has their hand raised. So Zainab.
Hi, thank you so much for sharing your journey and being so honest with us on this process. So my first question is that I believe in the beginning you said that you unfortunately didn't get accepted the first time you were applying. So what did you learn from that process and how did you improve for the next time you applied?
Yeah. So I want to say nursing school is very, very competitive. But with that being said, any program in healthcare is very, very competitive. What I learned from my first time applying and getting rejected was that I think I just didn't bring enough to the table. I didn't really have any experience at all whatsoever. The only thing that I really did when I applied the first time was finish all the prereqs. And that showed me that I can't do the bare minimum. Like I have to do things to really make me stand out as an applicant. And that's one of the reasons why I became a nursing assistant, so that I could get that experience to show to admission that, I'm very serious about becoming a nurse. I also took 2 of my classes again, just so I could get a better grade in it, to kind of just beef up my prerequisite and my resume and my applications when I applied again.
All right, thank you so much. And my last question is how you mentioned how nursing gives exposure to nearly almost everything. So are nurse practitioners able to flexibly switch around different departments, or do they have to stay specializing in a specific field?
That is a great question. And thank you so much for answering that question. So yes, being a nurse practitioner, you have the same flexibility as you would a registered nurse. Let's see, I'm going to go back to this slide right here about the different types of nurse practitioners out there. So if you are interested in any other field, let's say, if you were interested, you became a family nurse practitioner like me, where you see a little bit of everything and you can see anyone. But let's say I find that I really like working in mental health. I love seeing psych. I can actually go back and get my psych mental health certification, which usually will only take about a year or so. And then I get that additional training so I can go into psych and actually still function there. So you do have the same flexibility. As a family nurse practitioner, one of the sort of the nice thing about that is, again, since we know a little bit of everything, it's a little bit easier to go into a different area. But let's say if you want to make yourself stand out as an applicant in that particular area, then I would recommend, considering going back and getting one of these other certifications here for that particular population to make you stand out even more.
All right, thank you so much.
You're welcome.
Okay, our next question is from the chat. When you feel overwhelmed, what do you do to relax?
I like to take naps. So yeah, I like taking naps. I also have found that, I love, I have a great support group. I have my family, but I also have, I'm really close to some of my colleagues that I work with. We're all nurse practitioners. And I find that when I get overwhelmed, I can just share what's going on with me to these group of people, and they know exactly what I'm going through, which number one makes me feel very validated. It makes me feel like I'm not crazy or, overreacting. So besides making naps, I like to talk about it. I like to talk about it, and I like to specifically talk about it to certain group of people who will know what's going on.
Awesome. Okay. So we have one more hand raised from Alua Busola.
Hi. So my question is, after doing your master's in being a nurse practitioner, do you know if there's gonna be more time for school when you want to become a travel nurse practitioner?
So as a traveling nurse practitioner, you do not require any additional program or any additional training. I actually have quite a few friends who are traveling nurse practitioners. And for those who don't know what a traveling nurse practitioner is, it's basically someone who works a couple of weeks, or, we call these assignments, at one place. And then once they're done with their assignments, they can go and travel and work somewhere else. So no, you don't need any additional certification for that. However, if you are wanting to continue your education, so I am a masterate prepared nurse practitioners. However, there are also doctorate prepared nurse practitioner program as well. And doctorate prepared nurse practitioner programs, I find that for people who are interested in going back into like teaching or education, that would be a really good degree to have, because usually among your peers, that's what they have. And that's kind of like the end of the road for nurse practitioners. Like after you get your doctorate degree, you can't really go higher than that.
Awesome. Okay. So
Thank
now
you.
we just have some questions from the chat. So we'll do a couple more before we wrap up. But someone asks, did you ever look into being a surgical tech?
Yes, I definitely did. Because I love surgery, I looked into being a surgical tech. Surgical tech, for the most part, in my area, when I looked at it, was I think a 9-month program. And as a registered nurse, I found that I was able to get into that position without being a surgical tech. So when I worked in plastic surgery, I worked in private practice. And so I worked for a lot of like plastic surgeons, and they were able to train me in doing a lot of what like surgical techs would do. And so I didn't have to go back to school for that because they trained me in that area.
Awesome. Our next question is, someone says that their sister is in LVN school. Do you have any advice that you could give her?
Yeah. Is she like wanting to be a nurse practitioner, or like what? Can you specify a little bit more about what kind of advice?
I think that's all the questions said, but if the person that wrote that wanted to maybe add on a little bit, you're more than welcome to. And then while we're waiting for that person to add on, I think someone raised their hand, so we'll go to them first and then come back. So Sai.
Hi, I just wanted to say thank you so much for taking your time to speak about your experiences of being a nurse practitioner. I had a more personal question. So last summer, I did a CNA course. I'm a high school student, by the way, but I did a CNA course, and I wanted to, like, my interest to being a nurse kind of stemmed from that. But over the time, like researching about the different medical professions, I wanted to gear my career focus more to a physician assistant, but I know a lot of like things can happen. My my objective can change, but I was just wondering how that CNA course or having that experience would help me going into the medical field.
Yeah. That nursing assistant, and I'm sorry, are you working as a nursing assistant right now, or have you just completed the course?
I've just completed this course. I think some of the jobs that I have to take, you have to be 18 and older for the ones around me, and I'm not 18 yet. So
Gotcha. Well, number one, even if you decided that nursing is not the route for you, getting that CNA certification, and then hopefully if you are able to get some experience as a CNA, again, that's going to show that you're very serious about healthcare. And again, even though CNA, there's the word nursing in it, you're still doing direct patient care. And I think, that's kind of like the big picture. We don't necessarily look at your title to see what you were doing in healthcare essentially exactly, but we just want to make sure that you have direct patient care experience. So you know what it's like to interact with patients, and this is what you want to do essentially. So I think, getting your CNA, it's not a bad thing. And once you're 18, and if you are able to get a CNA job, I think it's going to look even better on your application, even if you decide that you want to be a PA, again, because you're going to get that direct patient care experience.
Okay, thank you so much.
You're welcome.
Awesome. So we'll do just one or two more questions from the chat, and then the last person that has their hand raised. So our chat question is, although nurse practitioners have more autonomy than registered nurses, do you believe that people have a negative stigma when they come to see you because you're not a doctor? If so, how do you deal with this?
Yeah. So unfortunately, I have had those interactions before. And even though nurse practitioners has been around for, half a century here, I still find that there are people out there who have no idea what a nurse practitioner is. And when they hear the word nurse, I think they kind of just fixate on that. And so they're like, oh, you're a nurse, like you don't know what you're talking about. And I think it's fine. I respect everyone who comes in. And if they tell me, oh, I want to see a physician, I don't argue. I don't push back. I'm like, okay, let me talk to the front desk and we'll get you scheduled in to see a physician. I also find too that when people are like, oh, I thought I was seeing a doctor, that gives me an opportunity to educate the patient about my role and what nurse practitioners are. And then I would let them make that call if they want to continue the appointment with me or if they rather reschedule to see a physician. But really, I think, the way that I respond to that is that, again, I just educate patients on my role, what I can do. And then I give the ball and I let them choose whether they want to continue seeing me or if they want to see a physician instead.
Awesome. Okay. I think Sophia has her hand raised.
Yeah, my question is, first of all, hello, I'm a medical student from Nicaragua. And what I wanted to ask is that it's really hard for me to have free time, so I pretty much just basically sleep and study. So I was wondering if you could give me any advice regarding organization of schedules to having a good balance.
Yeah, for sure. When I was in grad school, that was my strategy right there, was to study as much as I possibly can and then sleep and then do it again. But for me, I actually found that that was not the best way for me to study. It was very hard for me to retain information. And so that was where I had to really learn what my learning style was. And for me personally, I found that I don't learn very well when I just read the text. I find that if I do flashcards, I find that if I watch certain videos, and you can find a whole bunch of medical videos where they teach you things on YouTube that are amazing. And if you want, I can send you some that I have. I can't recall them on the top of my head, but I have a couple of YouTube channels where they go over basic information really, really well. And I found that those videos were really essential for me to understand certain concepts. So learning just my style, figuring out what worked best for me. And by doing that, I actually found that I studied maybe 3-4 hours a day. And then I actually had time to do other stuff that I like. And I found that by doing that, I was able to retain information more. And I was just a happier person.
Thank you so much.
Awesome. Okay, so our very last question for today is, could you talk a little bit more about being a nurse practitioner in the psych field?
Yeah, so I don't have much experience in the psych field. I do see a lot of patients in primary care for depression and anxiety as a family nurse practitioner. I think the other thing too is when you're a nurse practitioner, or really when you're any type of healthcare provider, is really knowing your boundary and what you know and what you don't know. And so when patients come to see me, if I feel like their depression or their anxiety is something that I can manage, I will definitely do the best that I can. But let's say I talk to a patient and I start to feel like, I think there might be like some bipolar that's going on or something more that's going on. I definitely do refer out because it's not any good for the patient if I just kind of like take my time with them. At the first sight, if I feel like there's something more that's going on, then I would just refer them out. And then I think in terms of like some feedback that I've gotten from my other colleagues who are actually psychiatric mental health nurse practitioners, I also from their feedback, they, especially in their first couple of years of practice, they do tell me that even though we are autonomous, they still have a physician or a colleague that they check in with every so often. They consult with these people anytime they have like a really difficult case. And so I think that's another thing that's really important too, is that when you become a healthcare provider, if you don't know something, like don't pretend like you know, because this is someone's health that's in your hands right now. This is someone's life. So if you don't know, just ask somebody.
Perfect. Okay. I think those are all the questions that we have for today. I'm so happy we were able to get through all of them. But thank you so much again for coming to speak to us. We will be sharing your social media so that our participants can follow you. And if anyone has any follow-up questions, feel free to message Michelle on Instagram if that's okay with you.
Yeah, that is perfectly fine. I welcome any messages that you guys have. Just a quick note, like I'm really bad at getting back to my messages. So if you send me a message and you don't hear a reply from me right away, like feel free to send me a follow-up. Like I won't get offended. I won't be bothered. I just sometimes lose track of time and I see the message and I think I'm going to respond to it, but then something happens and like 2 weeks has gone by and I never replied to you. So if that happens, just message me back again.
Sounds perfect. And yes, we will be sharing her social media after the session today. So don't worry if you didn't catch it during her segment. All right, perfect. Thank you so much, Michelle. Thank you again for speaking to us, and we hope you have a wonderful rest of your weekend.
Thank you. Thanks to you guys for all being here. Bye.
Bye. All right. So we have our first attendance poll for today. So it's just who was our guest speaker and what was their profession, like always. So please feel free to answer that now. I'll give everyone a little bit of time to do so. And then we'll move into our workshop. As noted, we won't have time to cover the anatomy and physiology of the cardiovascular system today, unfortunately, but we will be covering it either next week or we'll be sending out a recording of us going over it. But yes, we will be covering lots of neuroscience and neurology. Okay, I'm seeing that a lot of people have been responding to the poll. I'll give it another minute or so. About 85% of you have answered so far. So I'll give it another minute before I close it up. Okay, almost 90% of you get those answers in. And then if you can't see the poll, just message me on Slack and say, hey, I can't find it. And I will excuse you from it. It's
Hey,
just
Davina.
Hi.
Sorry about that. I was just wondering, what was the answer to yesterday's poll? How do you actually spell it?
Oh, okay. Ahmad, do you mind typing it in the chat?
Because I was like, wait, did I get it right or wrong? I think I chose like the longer one, and I was like, this probably seems like the answer.
No, that's fair. That's fair. I actually remember I didn't actually share the results of the poll, but Ahmad will type it in the chat now and then you can cross-check it.
Perfect, thank you.
No worries. But yes, hopefully you found yet the last session's poll question to be fun. If you can't find the poll, please let us know. Yeah, just message me on Slack. It's okay if you can't find it. And it's okay if you get the question wrong. Well, I'm very glad to hear you got it right. Okay. I'm going to give the poll another 10 seconds and then I'm going to close it. Okay, so please get your answers in now.
Sorry. So just to confirm, like, if we got, the name from yesterday wrong, is that okay? Like,
yeah.
do we still confirm our attendance, like, by just filling the poll?
Yeah. Just by doing the poll, you get attendance. So it's okay if you get it wrong. No problem. Okay, I'm filling the poll now. And then you'll have time at the end of the session to do our full attendance or our second one. Okay. All right, I'm ending the poll. Okay, so I'm really excited to go over our anatomy and physiology of the nervous system and more about neuroscience workshop today. So I'm currently a rising senior in university. I'm majoring in neuroscience. I've been wanting to major in neuroscience since I was like 7 or 8 years old. And I always love the opportunity to kind of share more about this field because not a lot of high school students really gain exposure to this field. And a lot of my friends in university that are majoring in neuroscience didn't have any exposure to it in high school either. So I think it's really important that you at least get to know it, even if it's something you decide later on that you don't actually want to pursue, which is okay. So I'm really excited again today to be talking to you about our nervous system. So our nervous system is really responsible for how we perceive the world, taking in all that sensory information. So if you can see me right now, great job. Your eyes and your occipital lobe are doing a great job at processing seeing me and then knowing that it is me, recognizing that I'm someone that helps run the program. Right now, I'm presenting, so it's involving my hands because I'm a big hand talker. It's involving some decision making and things like that. So there are tons of different activities that your brain is involved in. And this is only a very short list of that. Mental activities, simulating muscle movements, gland secretions. There's so many things that your brain is doing on the daily, every second, that we sometimes take for granted. So does anybody know what the components of the nervous system are? You can raise your hand. I'll hopefully be able to see it, or you can type it in the chat too. What is our nervous system actually made up of? Yeah, I'm seeing a lot of people in the chat saying brain, spinal cords, nerves. Perfect. Yes, lots of people saying brain, spinal cord, peripheral nerves. Yes, great job, everyone. You're all neuro experts. Yeah, so our nervous system is really comprised of our brain, our spinal cord, and all of our peripheral nerves and our sensory receptors. And here's a diagram to help you kind of visualize that. So everyone knows where your brain is inside your head. Then you have your spinal cord that runs down, and then all of your peripheral nerves extend from there. They gather information, sensory information from the world, and they relay it back to your brain and your spinal cord. So why is our nervous system actually important? I know I mentioned a few things that it does, but like, why is it really important? There are tons of different answers for this, so feel free to type it in the chats. Feel free to raise your hand, whatever works best for you. People are saying it controls all the other systems, gets you out of danger, gives commands, controls the rest of your body, allows us to walk, alerts you for danger. Everyone's saying wonderful things in the chat, and you're all right. Identifying and responding to the world, coordinating with our other organs. Yeah, definitely. Saving our life, responding to stimuli. Perfect. Yes, everyone is saying wonderful things, and you're all right. So our human brain, for reference, contains nearly 86 billion neurons. Our nervous system is responsible for essentially holding us together. It's relaying so much information about how we're thinking, how we feel, how we move, how we speak, how we make decisions. And this is all thanks to this principle or concept known as neural circuits, which is essentially a neuron, which is the primary cell of the nervous system, communicating with other neurons or other cells in the body. And another really powerful thing about the brain is that it's highly plastic. Now, when I say plastic, do I mean that our brain is made up of physical plastic, like the hard, sometimes squishy stuff, or do I mean something else? Feel free to let me know in the chat. What do I mean when I say plastic? Yeah, so one says plasticity, like it's flexible and can adapt, the brain's ability to learn, neuroplasticity, yes. Good job, everyone. The brain can adapt, changing as you gain new experiences. Perfect. I love this. So everyone is right. neuroplasticity is the ability for our brain to change as it's experience dependent. So as you perceive the world and as you do new things, your brain can actually change structurally and functionally. So some examples of everyday neuroplasticity are when you create something new, like if you make your own song or you paint a new art piece, that is involving neuroplasticity because you're doing something that was not done before. You're learning something new, like this workshop. If you're learning new information in this workshop, that's also an example of how your brain is really plastic and how your information of neuroscience is dependent on what you learn in this workshop and what you might learn from other sources too. Figuring out how to use your new school laptop, figuring out how to get to your new school. And neuroplasticity is often talked about in early childhood development. Now, neuroplasticity is really important when we are young, and not even just in humans, but it's been observed in mice and in barn owls too, because there are these periods of time known as critical periods where these organisms need to get some kind of sensory stimuli, like they need to be exposed to light or to sound in order for that region of the brain to develop properly. We also see plasticity in individuals or patients after they might suffer a traumatic brain injury or they might lose functioning in one area of the brain. And we find that another area of the brain actually takes over the role or the functioning of what was lost. And the patient actually regains function, even though that area of the brain might be lost or is not functioning as well. So it's really, really cool. Again, some other functions of the nervous system is controlling our ability to move. We mentioned that. Thermal regulation, so your body temperature. Reflexes. Reflexes are so important, like your knee-jerk reflex, which your physician or nurse practitioner might check when you go in for your physical. And it's helping our body communicate with one another too. It controls your endocrine system, which releases hormones like adrenaline, preparing you for fight or flight, or for other things like that. Yeah. So this is how our central and peripheral nervous system are set up. But before we get into that, does anybody know what the difference is between our central and peripheral nervous system is? Feel free to raise your hand, feel free to use the chat, whatever works best for you. What is the difference between our central and our peripheral nervous system? I'll give it a sec. And no worries if you don't know. All right, I'm seeing lots of things come in. Central is brain and spinal cord, peripheral is all the branching nerves, CNS, brain, spinal cord. Yep, people are saying lots of the same things. And all right, great job, everyone. Yeah, it's like the brain and peripheral of the nerves, exactly. All right, perfect. So as you can see in this diagram that I might have showed you a second too early, so sorry about that. What you can see in pink is our central nervous system. So it's comprised of our brain and our spinal cord, like a lot of you were saying in the chat. Great job, everyone. And then our peripheral nervous system is comprised of all of these nerves that extend out from our central nervous system. And it's really important that we have this separation between our central nervous system and our peripheral nervous system because we need two different parts of our body that gather information, one that gathers and one that processes and makes decisions. So our central nervous system is known as that integration center. So that's where your brain and your spinal cords are making all the decisions. You know, if you touch something really hot, then that information travels to your spinal cord and your spinal cord sends a message out to your motor nerves and you instinctively, like you retract your hands super fast, even before you sometimes think about it. I do this a lot. I burn my hands a lot on hot pans and sometimes hot water. But I'm so thankful that I have reflexes because those burns could definitely be a lot worse. And so that's why our central nervous system is so important. It helps keep you alive. It helps process information from the outside world. And our peripheral nervous system is also so important because it's actually getting that information from our sensory receptors. Our sensory receptors are getting that information about what we're touching, what we are feeling, what we can see, how much light there is outside, etc. And then it relays that to our decision-making center, and then a decision is made and that gets sent out to our body. All right, so this is another breakdown of our nervous system. So we just talked about our CNS or our central nervous system, and we also talked about our peripheral nervous system. So to kind of break down our peripheral nervous system a little bit more, we have our somatic nervous system. So it's controlling our voluntary muscles. So right now I'm moving my hands as I'm talking. That's involving my somatic nervous system because I'm choosing to move my hands. And then our autonomic nervous system, which is not under our conscious control. It's controlling our involuntary body functions so that we can break that involuntary nervous system up into the sympathetic nervous system and your parasympathetic nervous system. Now, which one of those do you think is known as our fight or flight response? Is it the sympathetic one or a parasympathetic one? Yep, I'm seeing lots of people in the chat saying sympathetic. Exactly. Your sympathetic nervous system is what arouses your body to expend energy. So if you're in a situation where you might feel a little bit anxious or you might be in danger, your body will release adrenaline or norepinephrine and let you know, hey, fight or flight, you gotta run. It's preparing you for a fight. That's an evolutionary response too, because long ago we had to hunt and forage for all of our food and fight people for it, and before we, kind of civilized as a society. So it's kind of an evolutionary response too. And our parasympathetic nervous system is what we refer to as our rest and digest. So it's calming our body to conserve and maintain energy. That's why it's important for you to, not go swimming directly after you eat. You need to give yourself some time to rest and digest. So now we'll talk about the lobes of the brain, because we're kind of talking about the functional anatomy right now. So our frontal lobe contains our primary motor cortex. So it's really controlling a lot of aspects of speech, emotion, memory, higher cognitive skills, and many aspects of our personality. Our parietal lobe and our frontal lobe, you can see here in purple right at the front. And our parietal lobe, you can see here in yellow. Our parietal lobe contains our somatosensory cortex. So it's integrating sensory signals from our skin and information about taste. If you want to Google the motor homunculus, it's a fun little diagram that shows what our body would look like if we had a nerve ratio where the body parts that were the most innervated or the most sensitive were the largest. So it's a fun diagram to look at. And you can do that in your free time if you'd like. And then we have our temporal lobe, which is seen here in pink. So it's right beneath, it's right beneath our yellow parietal lobe. So our temporal lobe is where our primary auditory cortex is. So our auditory cortex is responsible for processing sounds and audition. And then our occipital lobe, which is all the way in the back here in blue, is where our primary visual cortex is. So if you're seeing colors right now, if you process information about shapes and all of that good stuff, thank your occipital lobe for working out. So now we're going to talk about some cells, some really important cells of the nerve. Okay, so we have neurons, which are electrically excitable cells that transmit electrical signals. And then we have glia, which are cells that help support our neurons. Supporting our neurons is so important because neurons have a really big responsibility of communicating a lot of information from our nervous system and which involves our brain and our spinal cord. So it's really important that we have glia here to help support our neurons. So yeah. Some of our glia. So we have astrocytes. Astrocytes are the most abundant, versatile, highly branched glial cells, and they help cover the capillaries. Does anybody know, do we have more neurons or do we have more glia? Which one do we have more of? Ooh, you all are fast. Yes, glia. We have more glia in our body than we have neurons. And not a clue? Totally fine. That is perfectly okay. No worries if you don't know literally anything that I'm talking about. That's how you do the workshop. But yes, we have more glia. It's about a 3-to-1 ratio, actually. So our astrocytes, as I mentioned earlier, they help cover our capillaries. So what do our astrocytes help us form? Does anybody know? And it's okay if you don't. What are our astrocytes helping us form? I see someone saying myelin sheath. That's a great guess, and we will get to that soon, but that's not what our astrocytes are directly helping us with or helping us form. I'll wait another second and then I'll move on. Sorry about that, everyone. Yeah, I'm seeing lots of great guesses in the chat. Synapse formation, the myelin sheath, neurons, neural circuits. Those are all really, really great guesses. So great job, everyone. And this question was really tricky, so don't worry that you didn't get it. But our nervous system glial cells, known as astrocytes, are helping us form our blood-brain barrier. And our blood-brain barrier is so important that we have a slide about it. So our blood-brain barrier is made up of these really tightly packed endothelial cells that are lining the blood vessels, and they restrict what can enter the brain. And so why is this important? Well, this really helps protect our brain, right? Our brain is so important and it's so sensitive and responsive to information. We don't want anything that's not supposed to be there entering. So it's really good that we have this blood-brain barrier, but on the downside, it's preventing most drugs that are delivered by typical methods like injections or pills or patches from entering there, because your brain thinks that it's a foreign substance and it's like, no, thank you, I don't want you here. So scientists have actually developed a workaround. So what they do is they take these really, really small molecules that can pass through the blood-brain barrier because they're really tiny and hydrophobic, and they actually sneak the drugs in those tiny molecules to kind of get them across the blood-brain barrier. But it's still definitely a challenge, and there's a lot of research being done about this. That's why sometimes diseases or disorders involving the brain or the nervous system are harder to treat because your brain is a little bit fussy. Another really important glial cell, the microglia. So they're really small spiny cells found in your central nervous system, and they're phagocytes. Anybody know what phagocytes are? Immune cells, yes. White blood cells, they engulf foreign matter. Yeah, I like to think of them as our body's trash cans. So they take in everything that we're not supposed to have. Eating up the pathogens, yes, and we really need those. So it's super important. Another really important type of cell that we have in our nervous system are ependymal cells. So these cells line our CSF-filled cavities. Anybody know what CSF stands for? Cerebrospinal fluid, yes. And our cerebrospinal fluid is what our brain and our spinal cord rests in, and it's really nutrient rich, so it helps feed our brain. Our brain is super hungry because it uses a lot of energy and does a lot of things. Okay, our last two glial cells that we'll be talking about are oligodendrocytes and Schwann cells. So oligodendrocytes and Schwann cells serve similar, if not the same purpose. They both myelinate axons, and we'll be talking about myelination in just a second. But does anybody know the difference between where they actually myelinate? So oligodendrocytes myelinate axons in one area and Schwann cells do it in another area. Anyone got a clue? I'll check the chat too. Yeah, oligodendrocytes myelinate axons in the central nervous system, and then Schwann cells myelinate axons in our peripheral nervous system. Great job. Lots of great responses in the chat. Yes, good job. All right, so what are some features that make neurons unique? And we'll talk about this, but does anybody know or have any guesses? There are a lot of different ways in which neurons are unique, but if you want to field a guess, please feel free to. They have axons, yeah, definitely, but they're non-replicating. Yes, we are born with all of the neurons that we will ever have. They don't divide, yes, they can't be regenerated. They have dendrites, yes, their morphology or their structure, the way that they look is super unique. They have synapses, yes, their shapes can vary, they have gene function.
Transfer
Great job,
information.
everybody. Yes, they can transmit information, awesome. It can last for a lifetime, definitely. We definitely need all the neurons we are born with to last with us as we go through life. They're specialized for communication, perfect. Exactly. So this is what a neuron looks like. It looks a little bit different under the microscope, but this is the best anatomical diagram that we can provide you with. And so just to kind of go over why it's so unique structurally is we have these processes known as dendrites, and they kind of stick out of the cell body of the neuron. And what these dendrites do is they're kind of like information receivers. So they want to grab all the information from that the neuron would be receiving from a previous neuron or from another cell or something. So we have those dendrites to kind of grab that information, and they have those sensory receptors or those neurotransmitter receptors that the neurotransmitters can bind onto and then enact cellular change. We have an axon here. An axon is how information or an electrical signal travels through a neuron. That axon is really important for maintaining the integrity of that signal. And then at the end here, we have our terminal boutons, or what I like to refer to as our axon terminal. And that's where we have the release of neurotransmitters. So those neurotransmitters can bind to another neuron and continue kind of that cascade of information. Yeah. And so something that's really, really unique about neurons is that they are electrically excitable. It is one of the most fundamental principles that makes our nervous system so special, that it can communicate with other neurons and other parts of our body. But to kind of understand how neurons are electrically excitable, we have to first understand the concept of a resting membrane potential. And every cell in your body has a resting membrane potential, but it's super important for our neurons especially. So the resting membrane potential of a cell, does anyone want to give it a go or give it a guess? You can type it in the chat. What is a resting membrane potential? What does it mean? You can be super simple. No numbers or anything. What is our resting membrane potential?
Hi.
Yeah, so it definitely has to do with signals and what the charges are at rest, definitely. The balance of ions before a stimulus, difference between outer and inner membrane. Yes, so the resting membrane potential, and great job everyone, you're fielding great guesses. So our resting membrane potential is a voltage difference between the outside and the inside of the cell. So it's just, what is that charge numerically? What is that difference between the outside and the inside? And so what contributes to our resting membrane potential? How do we actually figure out what the voltage difference really is? So we have ions that the membrane is permeable to and impermeable to, as well as ion channels that help with this. So the more positively charged ions you have inside the cell at rest, and the more positive it'll be relative to the outside of the cell, and so the more positive the resting membrane potential. So why is the resting membrane potential of our neuron about negative 65 millivolts? Well, it's because at rest, I'll go back a slide, you can see these leak potassium channels here in blue. At rest, these are the only channels that are open. So our positively charged potassium ions are continuously leaving the cell. So because we have positive charge that's continuously leaving, we're actually making the inside of our cell more negative. And you might be wondering, well, there's sodium here too, and chloride, why does that not matter? Well, sodium can't enter the cell until the axon or the neuron is depolarized. It can't enter it. It's triggered by the neuron reaching threshold and generating an action potential. So that's why it doesn't matter as much, because the neuron is impermeable. I'm not saying it doesn't matter at all, but potassium is really the driving factor in determining the resting membrane potential of the cell. And then why is this important? Well, it's because it allows for the cell to become depolarized to generate an action potential, and action potentials are how we communicate information in this nervous system. So this is kind of a graph that depicts what an action potential actually is. So you see here at negative 65 that we have our resting potential. So this is just a neuron at rest. It's chilling, doesn't have any information to transmit, doesn't have anywhere to be. It's in low activity mode. But then all of a sudden another neuron needs it to send information to something else. So another neuron will release neurotransmitters that bind onto this neuron's dendrites, and then that triggers an action potential, because the binding of those neurotransmitters allows this neuron to reach threshold. And once it reaches threshold, the action potential is all or none. It will go through this. So once it reaches threshold, where it gets a little bit more positive, your voltage gated sodium gates open, and now you have a ton of sodium rushing into the cell. When you have a ton of positive ions rushing into the cell, this overpowers our leak potassium channels. And so our potential of the cell gets super positive, up to about 35 millivolts. And then once it gets to be somewhere above there, the action potential has kind of traveled down the neuron. We don't need to stay at 35 millivolts. We want to go back down to negative 65 where we are at rest. So our potassium gates open up again to let that positive charge out. And then our voltage gated sodium channels enter an inactivation phase, so they can't open anymore and they can't let any more positive ions in. And so with the two of these working together, we repolarize our neuron. We have a little bit of an undershoot where it gets a little bit more negative, and then that resting potential is reestablished by our sodium potassium pump, which is a really, really important ion transporter. And so we've kind of talked about this concept of an action potential and why it's so important. And then to go back to myelin. So we talked about how oligodendrocytes and Schwann cells myelinate axons, but what is myelin and why is it important? Well, myelin is a fatty acid-based substance. It's a lipid substance that forms an insulating layer around our neurons. And so I want to show you this image. This is the same image that was on the slide before, but enlarged a little bit. And what you can actually see here is that if you look at the bottom, you can see an unmyelinated axon. And so there are some physics concepts to understand here when we're thinking about neurons and how they propagate action potentials. One is that the longer a charge has to travel, the more space it has to travel, which is known as a space constant, the more likely it is that that charge is going to dissipate. It's going to, it's going to get less strong, less positive. It just has a smaller chance of reaching the end here and successfully targeting another neuron. So that's our space or our length constant, and we also have a time one. So the amount of time that it takes to get there also makes a difference. But when we have myelination, what you can see here is that it kind of wraps around our axon in these bundles, and these bundles are super tight. They're not letting any charge get out because they're super hydrophobic, and our charges are not hydrophobic. They are either positive or negative. We've got our sodium, potassium chloride ions, and they do not mix. They're not getting out. And so what ends up happening is our ion channels can only happen on these little nodes of Ranvier, or these little gaps in between our myelin sheath wrapping. And so what ends up happening is our action potential kind of jumps from here to here to here to here to here. So where you can see all these arrows, that's our action potential propagating. It's called saltatory conduction. And because it has to travel, it has to, spread across less, it's just jumping, this actually increases our conduction velocity by up to 100 times. So that's why myelin is really important. It helps our nervous system, and it helps our neurons propagate those action potentials as efficiently as they possibly can. Because we need information to be transmitted quickly when we are talking about our nervous system, right? You can't touch something hot and then wait like 10 minutes for your brain to realize that it is hot and you should remove your hand, right? We need these things to be really quick. And so one way that reflexes are really quick is that they involve your spinal cord. It doesn't travel all the way up to your brain first, so your spinal cord makes that decision. And then another thing is, it's all thanks to myelin. Myelin is helping us make these processes so much faster. Oh, someone says this is making me become really interested in neuroscience. I'm so happy to hear that. What would happen if someone does not have myelin? That is a wonderful question. So we're going to be talking about some diseases and disorders in a minute. But before we talk about that, I actually didn't include this one, but there is a disorder known as multiple sclerosis, which is basically where your myelin sheath is getting attacked, and it works less, right? Your neurons are being covered in myelin less. And so with disorders like this that kind of attack your glia that are producing myelin, or attack your neurons that have myelin, what ends up happening is you kind of just experience degeneration of your central and your peripheral nervous system, unfortunately. So that's why studying neurodegenerative diseases is so important, because we want to figure out ways to combat these issues. All right, so now we've talked about an action potential. It's traveled to the end of our neuron. Great job, myelin. Did a great job. Okay, so now we have to communicate with another neuron. So what ends up happening is we have an electrical signal that's converted to a chemical one here at our axon terminal. So in our axon terminal here, what gets released here is our neurotransmitter. So can anyone give me an example of a neurotransmitter? You can type it in the chat. Epinephrine, yes, great. Serotonin, awesome. GABA, that's a great one. Oxytocin, GABA, acetylcholine, perfect. So different neurons have different neurotransmitters. And so let's say this is serotonin. Once that action potential reaches there, that electrical signal is converted to a chemical one. And so that neuron releases serotonin onto the next neuron, keeps that signal going for as long as it needs to. Great job, everyone. Loving all the neurotransmitter examples in the chat. So I know that was a lot of information. So I have written the steps out again here in case you're like, I don't remember what happened after we generated an action potential. That's okay. It's a lot of information. So definitely free to take a breath if it's overwhelming. So the steps are that first, a neuron at rest is receiving a depolarizing signal that reaches threshold. Once it reaches threshold, awesome. We're going to generate an action potential. It's all or none. Once you reach that threshold, no matter what happens after, it's always an action potential. It doesn't have to be, like maybe it only goes a couple over or it just barely reaches it. An action potential will always be generated. That signal is going to propagate through the neuron thanks to myelin, thanks to our ion channels, thanks to our resting membrane potential. So it's traveling through the neurons. Then it reaches the end, the axon terminal. It's converted into a chemical signal. Those neurotransmitters are released from the neuron. They bind onto the receptor of their target. Then they prompt further cellular response. So now let's talk about some disorders and diseases that involve the nervous system. This is not a comprehensive list. There are tons that I unfortunately wasn't able to include here for the purposes of not wanting to keep you here for 8 hours. But you can definitely do more research on childhood disorders, on psychiatric disorders, on neurodegenerative diseases, if you want to in your own time. But I just wanted to include a few from each category so you can get kind of a feel for it. So these first ones are childhood disorders. So we have Fragile X syndrome, which is caused by mutation in the FMR1 gene. So some symptoms include intellectual difficulties, behavioral challenges, etc. And some treatment options include speech language therapy, physical therapy, and social interaction. For people that have ADHD, some of the causes are environmental risk factors. So potentially exposure to lead, a low birth weight, and there are other environmental risk factors. Unfortunately, for some of these diseases, we don't have an exact cause, or we don't know what is exactly causing it. It could be a bunch of different things. Some of the symptoms include inattentiveness as well as hyperactivity. It's usually diagnosed in childhood, but sometimes it's not. And in order for it to be diagnosed, the behavioral issues must be present both at home and at school. And some common treatment options, the most popular one is stimulants. They do offer non-stimulants, but they are both less commonly used and they're also less available. We have Down syndrome, which is caused by a trisomy on chromosome 21. So some symptoms include some distinctive facial features, hearing loss, and unfortunately, most of the people that have Down syndrome, unfortunately, are predisposed to developing early onset Alzheimer's because they have a mutation in their APP or amyloid precursor protein gene, which is associated with Alzheimer's, which is very unfortunate. And there also, unfortunately, is no treatment right now, but I'm sure that scientists are working on this. And I think I've heard of some research being done on this as well. People are always studying childhood disorders, neurodegenerative diseases, and such. So it's nice that there are a lot of fields in the world that are interested in helping out with the neurosciences. Then we have autism. So autism could potentially be caused by environmental factors. There are some different genes that are associated with it, but we're not too sure. Some symptoms include difficulties with communicating, maybe difficulties with social interactions, and sometimes repetitive behavior. There are lots of treatment options like speech language therapy, physical therapy, education, and with Down syndrome and autism, neither are fatal, so people can live long, happy lives, which is awesome. So these are some of our psychiatric disorders. So first up, we have obsessive compulsive disorder. So some symptoms include obsessions and compulsions, so like excessive hand washing, excessive worrying about getting sick from a contaminated object, and repeating these behaviors to try to get rid of the obsessions. The obsessions and the compulsions kind of go hand in hand. Your obsessions are you're really, really excessively worried about something, and the compulsions are there to kind of counteract that. Something that sometimes people in mainstream media say that they are, quote, OCD about something, unquote, because they like to clean their room a lot, which I think we should be trying to stop because it's not very respectful to people that have OCD. So we're trying to create a more inclusive and supportive environment for people that do have psychiatric disorders. And then for major depressive disorder, some of those causes are genetics, environmental factors, and something known as the diathesis stress model. So our diathesis stress model, I wish I had a diagram to help support this, but it's basically a glass model where your genetics or your predisposition to developing major depressive disorder plays a role, and then also stress factors in life. So someone that is more genetically predisposed to it and experiences environmental stress might develop it, but maybe someone else experiences the same level of stress, but they're not genetically predisposed, so they might not develop it, it's kind of a cool model to study. Some of the symptoms include feeling sad or empty, loss or change in appetite, irritability, problems with sleep, a lack of interest in usual activities, and sometimes it's accompanied by other diseases. So some of the treatments that are currently used for both OCD and major depressive disorder are SSRIs, CBT or cognitive behavioral therapy, and DBS or deep brain stimulation. Anybody know what SSRIs are, what it stands for, what it does? Selective serotonin reuptake inhibitors. Yes, antidepressants. That's another word for it. Awesome. Yeah. So SSRIs are selective serotonin reuptake inhibitors. And I'll go back to my diagram of the synapse. So what happens here is once your neurotransmitters are released here, what ends up happening is we don't want that serotonin to stay there forever because then you might get an overactivity in response. So there are other molecules that come and kind of eat away and break down the serotonin. But for people that have psychiatric disorders, maybe there's less serotonin available. So what the selective serotonin reuptake inhibitors do is they prevent that serotonin from being taken back. We want as much of it in the synapse as possible because there's already less of it. All right. And then neurodegenerative diseases. So we have Alzheimer's disease, which could potentially be caused by misfolded protein buildups, prions, beta amyloid plaques, environmental factors. Sometimes we see that athletes that have traumatic brain injuries or chronic traumatic encephalopathies or CTE are more predisposed to developing Alzheimer's, and then mutations in some of the genes that are listed there. It's also associated with memory problems, difficulty concentrating, disorientation, personality changes, and then in the more moderate stages, trouble recognizing family. And for Parkinson's, we have that it's caused by a loss of dopamine-producing cells in your substantia nigra, which is responsible for some of your motor movements. And then mutations in PARK2, PRK2, and some other genes. Some of the symptoms include a resting tremor. So patients with Parkinson's experience a tremor while they are resting, while they're not moving. And this progresses to their hands and their feet as the disease progresses. Slow movement, motor rigidity, poor coordination, and emotional changes. And something important to note for Alzheimer's and Parkinson's is that both of the treatments I have listed there are FDA-approved drugs, but these are only symptom relievers. They're not cures for these diseases. They help with the symptoms. They help alleviate these symptoms, which is awesome for patients that have this. And it's really amazing that we've been able to develop our drugs this far, but unfortunately, not a cure. Okay, so now we'll talk about some research techniques, just briefly. But a sample research technique that you can use, and these are some pictures from one of my undergraduate neuroscience labs, is we use extracellular recording to record the resting membrane potential, which you all know about now, of crayfish muscle fibers. So this is kind of how the setup works. You have your crayfish and some saline, then you have a device here, an electrode that you have to set up, and then you turn some knobs and you have to perform a dissection and then try to puncture one of the muscle fibers there. And so it's really cool when you're trying to figure out, what is our resting membrane potential affected by? If I change this ion concentration in the saline, will that change the resting membrane potential? All great questions to ask, and you can test that via something like this. And crayfish have a relatively simple nervous system, so it makes experimenting on them more ethical and more feasible. Some other techniques that are more imaging based are fMRI. So it's measuring brain activity with changes in blood flow. We have MRI, which is the structural version of that. So it's creating these really detailed images of organs within the body, not just used for the brain, but also commonly used for the brain. We have CT scans, which compile a series of X-ray images from many different angles around the body, can help diagnose tumors, check for internal injuries, and so much more. And then these are some extra research techniques here. We also have some cell staining, cell tracking, cell tracing, delivering drugs to specific areas in the brain. So these are also ones to read up on if you would like to. So our interactive homework that is optional, you do not have to do this if you don't want to, it is not required, but if you'd like to, you can, is to do some background research on some of the research techniques and stains provided on the previous slide and others. There are so many more that I didn't include, and design a simple experiment to help solve this question. So patient enters presenting blurry vision and disorganized thought. You want to definitively determine whether the blurry vision is caused by either a tumor pressing on your optic nerve or structural deficit in the occipital lobe. So how can you go about narrowing down these potential causes of blurry vision? Be as specific as you possibly can be. And so if you message these to me before Monday at 3 p.m., I believe, or 2 p.m. Eastern Daylight Time, our most detailed and thorough response will receive a shout out at the beginning of our next session. Again, this is not required if you don't want to do it, but if you'd like to get some feedback on designing a simple experiment and just dip your toe into the pool of research, feel free to do this, because I had an undergraduate class where we did a lot of this, where we were given a lot of research techniques and we had to kind of solve our own research questions. I thought it was really incredible. Okay, so do you find neuroscience exciting? Do you want to get involved in high school? I have some information for you. You should do BrainBee if you want. So BrainBee is a neuroscience competition that's hosted in February or March or April, depending on the state or country you're in. It's open to all high school students. You don't need any prior experience in neuroscience in order to compete in BrainBee, but if you have prior neuroscience experience, that's great. You don't need it. So this is a picture of when I did BrainBee in high school in grade 12 or my senior year of high school. It was super exciting, such a worthwhile experience. I would definitely recommend it to anybody that's even a little bit interested in neuroscience. If you want to figure out whether neuroscience is something for you, or if you like the clinical side of it, or if you like other aspects of psychology and you're like, well, I'd like to compete with this, I would definitely recommend participating in BrainBee. Definitely one of my most worthwhile experiences in high school. So how do you actually participate? Well, it's available in every state and country, so you can search for a BrainBee near you. Typically, registration is open in September, November, or September, October, November, somewhere around there. I don't actually remember when I registered, but you can make a school. You can make a club at your school to prep. A lot of high schools don't actually know about neuroscience competitions like BrainBee, which is sad, but hopefully a lot of you attending this program will now know about BrainBee. And if your friends are interested in neuroscience, you can be like, hey, I heard about BrainBee. You might want to check this out if you're interested. I helped organize the Hamilton local BrainBee this year, which is in Ontario, Canada. And a lot of things students say is that they didn't even know that this was a thing, that this actually exists. So we really want to encourage students to learn more about BrainBee. So the way that you participate is you study the BrainFacts 2018 book and some older versions, because sometimes they pull questions from there. It's public access, it's free, it's online, you can download it, it's 120 pages or so. You study your basic neuroanatomy, like what we were talking about earlier with the lobes of your brain and the different auditory cortices and visual cortices. You study diagnosing patients, typically over the span of 2 to 3 months. The bottom right is a picture of when I did BrainBee as well. And then you go and compete. They offer it on a national and an international scale. So you can compete to represent your state, and then you can compete to represent the USA. So I competed in the state of Massachusetts, and then whoever won that, you can go ahead and then move on to represent the USA. And then whoever represents the USA, they compete against everybody else representing all the different countries of the world. Unfortunately, I don't think every single country in the world offers a BrainBee, but I think most of them do. So it's a really, really wonderful opportunity. And I created a BrainBee channel on Slack today. If you are interested in learning more about this, I'm always happy to answer questions you have, whether it's like study tips or how do I get started? How do I do this? Where do I register? Can you help me with like study tips or whatever? Please feel free to reach out to me. I'm always super happy, and I'd love to mentor some students this year if they would like to participate in BrainBee. So if you'd like to be mentored, let me know. But yeah, we'll put this all on Slack. I'm just reading the chat right now. People are saying it's exciting. Yes, it is super exciting. It used to be online during COVID, but now it's in person. When will it open? Usually like September to November, that time frame. But yeah, it's really wonderful. Okay, So we've talked a lot about some really heavy content. A lot of content was thrown at you. So now let's lighten the mood a little bit and talk about optical illusions. Why do they work? So why do we fall for optical illusions? Well, sometimes when there's not enough information, our brain tries to fill in the gaps with what we've perceived before. It's taking what we've learned in our experience and trying to apply it to a situation. We're trying to make sense of the world, and we're making an inference that the world is supposed to make sense. Okay, so for this first optical illusion, both these faces, do they look pretty normal to you? Just normal upside down faces? You can respond in the chat. Pretty normal. Some people are saying no. You might have already seen this already. When I look at these, they honestly look pretty normal to me. But when you look at it, it actually looks like this. So sorry if this gives anyone the creeps, but yeah, this is another example of our brain trying to take the path of least resistance. Sorry, someone in the chat just said terrifying. I agree. And just trying to make sense of the world in the most simple way possible. So it actually does look like this, but what we see in the previous slide is we see something that looks like this. It doesn't look that bad. I mean, it just looks like maybe a little bit of an abnormal upside down face, but it's really, really different here. Yes, big jump scare. So sorry, everyone. Okay, if you look at this picture, don't look at it for too long, you might get a headache. But what is it? What do you see? This is it's just a picture. It's not a video or anything, but do you see that it's moving? It looks like it's moving, but it's actually not moving. It is completely stationary. I put a picture here. It's not a movie, not a video, not anything. It just looks like it's moving. Yes, if you want to close your eyes till I move on to the next slide, go for it, because it can definitely give you a headache. I will move on. This is another one that is less freaky to look at. So this is a really cool one where you can see that there are two faces here. So I'll give everyone a second to try to find the two faces, and then I'll show you where it is if you're having a little bit of trouble. Because I had to look at this for a little bit, and it's like I don't see the second face. Yeah. Yes, so if you're seeing the face here, look, there's an eyelash here, there's a nose, and then you see the chin, and their head is kind of turned away. But if you want to look at it from another perspective, this is the eye, and you can kind of see this is the nose and the mouth and the chin. So there are two faces here. Yes, the ear can either be an ear or an eye. Very freaky. This is one of our Gestalt principles, figure ground. So you can either see a candle holder or two people's faces. Yes. Sometimes people can see both. But it's really cool because it's just this candle holder painted on a white canvas, but you can see these two faces too. Awesome job, everyone, seeing both. Yes, there is a face. If you look here, this is the nose and then the mouth. It's kind of like a mirror image. It does look like a villain, I agree. Okay, the last one. Oh no, second to last one. This one definitely gets me all the time. There is not a shadow here. This is all the same color of gray. This gray and this gray and this gray and whatever. It's all the same. A and B are the same color. Can you believe it? I don't believe it, but it's true. A and B are the same color. It's our brain telling us that we see so many shadows in our everyday life, and we know what a shadow looks like. It's kind of darker behind the image. And so we apply that principle here. We go, oh, there must be a shadow here. Must be a dark color. It's not, they're the same color. Yeah, big side eye. Melting some people's brains right now. So sorry about that. On a Friday evening. And the last one, which is the most controversial one. Some people have been arguing about this for years. What color is this iconic dress? I see white and gold. Some people see blue and black. This is a throwback. Okay, people are seeing white and gold. This is good. Someone's saying blue and black. I don't know if I agree with that. I don't know. Zainab, do you have your hand up?
Oh no, I'm sorry. Amanda just had to raise your hand if you couldn't tell if it was like a shadow. So like that's why I had my hand raised.
Oh,
Perfect, perfect.
wow, that's impressive.
Yeah, that was very good. The actual dress is maybe blue and black, but I believe that it is white and gold. This was super controversial, but everyone on the internet was talking about this years and years ago. So I wanted to ask all of you what you thought. Oh, someone sees pink. Okay, that's new. All right. Someone says they genuinely can't see gold. There's no way you guys are seeing white and gold. I'm so sorry. I definitely see white and gold. Alexis, do you have your hand up?
Yes, I had a question. Is this the same, or does this count as the same when people hear certain phrases or are told to hear certain phrases and they hear different things? Like, does this count as the same? Like when you see certain photos and one person sees something and you see another thing?
I think they're kind of different principles, but definitely yes. When you are told that you might see this or you might see this, you're expecting it more, and then you're more likely to see it. Absolutely, yes. Amar, did you have a quick question?
Yeah, I want to know what is the reason of being different people sees different colors from their sites, or
That's
what
a
is the reason?
that's a really, really good question. Honestly, I don't know, and I don't think people know why they see different colors. Maybe if you do some research and you find out, feel free to share it with us. But
Yeah.
yeah, sometimes we just see different things, and it's crazy.
So until now, we have no reasons, right?
Up till now, I don't think there's any strong conclusive reasoning, but there are definitely theories.
Yeah, yeah, okay, thank you.
Yeah, no worries. Okay. All right, so hopefully everyone has gotten a chance to look at the iconic dress again, or if you're seeing it for the first time, hopefully this was a great experience for you. All right, so that brings us to the end of our workshop. We talked about a lot of content today. So what I want you all to do is to say thank you to your brain. Now you know all the wonderful things your brain is doing for you. Say thank you. You're doing so much. We didn't even talk about all the things your brain does for you or your nervous system. So say thank you. It's doing so much for you. And then just some weekend reminders. So we have our medical debate happening this Monday. So our topics are going to be released either later tonight or early tomorrow, and we'll go over some details about how that's going to run. And then if you're interested in chatting with people on Discord, if that works better for you than Slack, we'll be launching our Discord platform tomorrow if that's a better way for you to communicate with people. Submit your interactive homework, include your program type if you want to be entered to not win a shout out, but if you want to be considered for a shout out, to me on Slack by Monday at 3 p.m. Eastern Daylight Time, and then get outside, get some rest, have fun. It's definitely been it's been an amazing week, but we want to make sure that you all, are taking the time to take care of yourselves. It's 2 hours, 3 times a week. We want to make sure that you're balancing this program with doing fun things and taking care of yourself too. So I'm gonna release our last attendance poll, and then you're more than welcome to head out. Message us if you have any questions. As always, I'll send a message out about the BrainBee channel if you want to learn more about BrainBee, get involved with it, etc. And then we'll stick around if you have any questions. I really hope you enjoyed the neuroscience workshop. Sometimes people realize neuroscience isn't for them, but I really just hope that you learned something fun and new, and that it was an interesting experience for you to kind of learn something that you might not have learned in high school. And I really enjoy teaching neuroscience, so I hope you all enjoyed it. All right, I'm releasing the poll now. There's one right answer. I just want you all to know. A lot of you are getting this wrong. If you can't see the poll, just message me on
So
Slack.
confusing.
I'll actually share the results at the end too. Yes, this is very controversial. I actually think this is the most split we've ever had a poll. But yes, if you have to head out now, you're more than welcome to at 7 o'clock. Please go get outside, have some fun with friends and family. And after you've answered the poll, if you want to head out, you don't have any questions, feel free to. Thank you so much for being here with us for our first week of our summer program. It's been so lovely getting to meet all of you and interacting with you. We hope you had a great first week experience, and we can't wait to move into our second